So good morning, buongiorno. Thank you all for coming in. I'll take a few minutes to really set up what we call in Silicon Valley the value proposition of this innovations in global health professions education, which started as an initiative, as an open access journal, and hopefully is going to be turning into a movement very soon. So I will take about 10 minutes and share with you why the theme of this conference, which is the second annual conference, is divided into three sections, three sub-themes, looking at preparing the health professional for 21st century, looking at practicing across borders, and digitalization, which is coming our way rather rapidly. So let me get started here. So just by way of background, this initiative really took a while. About 5 years ago, Victor Zhao, there is Victor, who's president of National Academy of Medicine, and myself, we were talking, at dinner. Victor was at the time president of the healthcare system at Duke, and also had established an overseas medical school in Singapore through Duke, and I was the dean at Weill Cornell Medical. By the way, my name is Javaid Sheikh. I'm the dean. Thank you. This is a problem with, when your brain is going one way and your mind is still somewhere else. So my name is Javaid Sheikh, Dean for Weill Cornell Medical College in Qatar, and also the co-chief editor for this Innovations in Global Health Professions. So Victor and I were talking that Lancet report has just come out, and the recommendations are fantastic. We all agree. But how would we go about implementing them? And we need to do our own part because we have some experience in establishing campuses, U.S. campuses overseas. And then that led, after a while, to an open access journal, and then further forward, really, this interactive platform. For the last 2 years or so, both my colleagues, Dr. Robert Krohn and Dr. Troya Racy, have played a major role in getting this movement forward, and they are now associate editors for the journal also. So the overview is, all of us agree there are major issues in healthcare. Lancet Commission's report, I'll just touch on the main recommendations and talk just a little bit on the need for increasing accreditation and harmonization, because that is needed, and that's really one of the themes in terms of practicing across borders. Major disruptions are on our way. We all know that, because for the first time there's a real convergence of digitalization and biology, not to talk of AI coming on board and nanotechnology. And I will then show a slide in terms of the value proposition of IGHPE and introduce very briefly, but my colleagues, both Robert Krohn and Troya, will introduce in more detail. All right, this is all very well known to you, major issues in healthcare everywhere, fragmented curricula. We as educators really have not done our job, not because we haven't tried, but we are working under a system, a framework, which is a century old, so it needs to be transformed. I talked about, in 2010, the Lancet Commission's report and the beginnings of this whole revolution of health professions, which means bringing all the other professions together, not only physicians, nurses, dentists, pharmacists, and others, public health professionals who need to come in the group, and it's going to be team-based training and team-based teaching of the patients, because the needs are too big globally. But more importantly, because of all these disruptions, any kind of things which will stick, any kind of recommendations will stick, will have to be tested out in real time, and that's why we created this interactive platform. That it needs to be tested, it needs to be based on real evidence that it works, and it can work in different parts of the world. So this is really a summary of the major recommendations of Lancet Commission. Primarily, easier way to remember this is the recommendations are both regarding the instructional changes as well as institutional changes, and also politically to mobilize the leadership. So if you look at the reforms, the top instructional reforms, we all know, is now competency-driven learning for the last 12, 15 years. Yes, interprofessional and trans-professional education, bringing all the professions together, IT empowered, of course, interactive and using technology to exponentially increase the chances of learning in so many ways, flipped classrooms, etc., whatever have you, to be locally informed, to be locally relevant and be globally informed, to look at the educational resources, bring them to the table, and of those, I would say probably the faculty development being the most important, and the new professionalism, which should be based on competencies as opposed to the silos. And then institutionally, Lancet Commission talks about, and the recommendations were that there needs to be joint planning between different systems, but not only the academics, but the policymakers and the frontline clinicians and the politicians. They all need to come together and do the joint planning, and academic systems need to become more than just the academic centers. They need to be academic health science systems. And Victor and his colleagues have written actually a series of articles about that, which is to expand it into primary, secondary, and tertiary healthcare systems and connect them quite well so you can use them, look at them as an opportunity for training and education as well as research. Global networks will be a natural follow-through there. I mean, this is just the beginning of global network here, for example, and the culture of critical inquiry has been talked about quite a bit. And in terms of enabling actions, just to make sure that these recommendations actually can work, to mobilize leadership and enhance investments from different sources, and not only from traditional funding sources in grants, etc., and government funding, but private foundations also. Accreditation, I'll just show next slide, is a very important issue, and if we have to look at healthcare across borders, it needs to be looked at very carefully, because at this time there's no globally accepted system of accreditation and alignment. And strengthening global learning, which of course will go with accreditation. And ultimate objective is to transform the health professions education in a very big way and make it very interdependent, professionally oriented education for equity in health, if we are to get there. All right. Very few comments about accreditation and harmonization. As I said, there is really no generally accepted system globally at this time. And there has been a lot of discussion. National Academy of Medicine itself has said that there needs to be a global summit every 2 years to facilitate this kind of harmonization. And EC at this time probably is just about the best system, although only for EC countries of accreditation. Maybe that would be a beginning. This is not to scare you, but disruption is on our way. I mean, I'll just say very briefly on the left-hand side, you can see biology and information technology just coming together, converging. On the right-hand side are the famous 5 or 6 Ps. But the important thing over there is the patient is in the center, and it's all going to be personalized healthcare, and yes, it'll be preventive because we'll have so much information, and predictive and precision medicine. But it's on our way. So what we are doing in terms of training our next generation of healthcare professionals is just not good enough. But if that was not enough, now you have whole larger field of education being transformed by itself. This is from the Economic Forum, Global Economic Forum in 2015, and now they're talking about not only the foundational literacies, which are generally when accepted, on the left-hand side, the literacy, numeracy, scientific literacy, ICT literacy, etc. But in the middle, they are now talking about core competencies, which critical thinking, problem solving, curiosity, communication, creativity, collaboration. And then beyond that, something which really is for the first time looking at what used to be the characterological issues or deep value structure, and try to put out some certain kind of characteristics: curiosity, initiative, persistence, adaptability, leadership, social and cultural stewardship, and awareness. So you can see the changes on its way. So unless there is a system, a framework to look at these things and adapt to them in a rapid fire fashion, but in a scientific fashion, based on dialogue, debate, testing out ideas, and mutual learning, is just not going to fly, right? I mean, Flexner report, it lasted 100 years, but that was an ancient world, really, compared to where we are at today. Things change so rapidly. So the framework has to be very flexible It has to be open to innovations. It has to be open to enhancement by those innovations. And that is what the IGHPE is proposing to do, to create an interactive platform. And the way we are talking about doing this is really to create an ecosystem which fosters innovation, which accepts failure as frequently or as openly as success, so to speak, as they do in Silicon Valley. Basically, not succeeding means nothing. It just means you tried an idea, it didn't work, so let's just improve it. And that's the kind of culture we want to foster. So we're going to have regional workshops. They're going to be annual conferences. This is the second one. We had first one in Doha, which was attended mostly people from the US. This one being attended by people both from US and Europe. Next year, we want to have one someplace in Asia and then South America. We do have open access journal. That's how it started, where the focus is on innovation. And then finally, we will have a group which will form partnerships and provide consultations regionally. Ultimately, really the objective is to identify the leadership in the field and those who are passionately committed to this idea, so we can implement ultimately the vision of the Lancet Commission and also bring our health professionals, when we train them, really prepare them adequately for the 21st century and build a very broad community and engagement. I will be remiss before I stop if I do not introduce our medical college, so I'll just take 30 seconds to introduce in one slide Weill Cornell Medical College in Qatar. This is a living, breathing laboratory of really how you have to innovate to survive. If you look in the middle, it says 2 years pre-medical, 4 years pre-medical program, which is how it was established. It was going to be US medical degree for the first time about 14 years ago, and we will prepare them instead of 4 years undergraduate, we'll prepare them in 2 years, and then they will do the regular 4-year medical curriculum and get the degree. What we found once we landed over there after 2, 3, 4 years, that it was, we were not in Kansas anymore, as I say, things were different. So K-12 education was different. The environment was different. And we had to renovate, and we did. So we have gone deep into the community in high school, identifying earlier those students who are interested in going into health professions, bringing them in, giving them 1-year foundational class, focusing on math and sciences and English, which is a major issue there. Then bringing them through the 6-year program, which has become an integrated program because the yield from pre-med to med, which used to be only 50% initially in the initial years, has increased beyond 90% now. So it's a continuous program. We have helped our colleagues at Hamad Medical Center get their accreditation, ACGME for residency training, and then we are working on our continuous professional development that I touched on a little bit earlier. But beyond that, in terms of, because it's a very small country and it has really very lofty ambitions and high vision, we are helping them in terms of producing capacity in the country in the area of research. Also on the right-hand side, you can see we are working with the New York Academy of Sciences on the Global Compact for early childhood education and then STEM education. At the same time, we're helping them set up systems in terms of exploiting the IP and setting up incubator systems. We are negotiating at this time Stanford to see if we can institute some of those systems. So this is what we're doing. I'm going to be stopping here, but not before I thank those who have organized this conference and selected this venue. So let me ask people to raise their hands when I read their names. Thoraya Eresi, she's also our Associate Dean for Continuing Professional Development and will soon be taking over the medical education in July. Robert Krohn, our Associate Dean for Clinical Affairs, and Bob is very well known in terms of his international experience, and he was the founder of Harvard Dubai initiative many moons ago. Amanda Pullen, who is the CEO of Strategy Implemented, has worked very hard to make this happen. Nicola Adair, who in addition to running the Dean's office over there at Weill Cornell, also spent a lot of time over here. Amanda Chin, let's see, from Strategy Implemented. And Renata Hayward, always cementing the glue behind the scenes. So thank you all. Let's just give them a hand together as a committee. And thank you all for coming in here and your willingness to really be able to share your experiences, because this is going to be a learning experience for all of us to test out new ideas and have a debate and discussion. Thank you.